as we all know, flu season has been taking a really bad toll on people and our healthcare system.
Yeah, on Tuesday, we had a conversation with Dr. Isaac Bogoch about this particular flu season. Now, he told us he expected that the flu peaked sometime over the holidays, but that doesn't mean the flu season is over. Plenty of it left, at least 1 to 2 months. And this has many people concerned, and some of our viewers reached out with questions for Dr. Bogoch. So what are we doing? Well, we're bringing the good doctor back to answer those questions for you this morning. So Dr. Bogoch, good to see you again. Thanks for being here.
Hey, good morning, Nick and Jen. Great to see you guys.
Yeah, thank you so much for doing this. We had to attend to our inbox, which got pretty filled from our segment on Tuesday. So our first question this morning comes from our viewer, Dave. Dave is asking, is there any truth that because of isolation during COVID, that our immune levels weakened because we weren't getting as sick as normal? Is this why the flu bug is hitting us harder?
Dave's got a very interesting point. Short answer is no. Longer answer is that people might recall the winter of 2022-2023 was very, very severe in terms of influenza, especially for kids. Pediatric hospitals were filling up, and it was extremely challenging. A very early start to the flu season, rapid rise, and then rapid decline. And the theory there is because many children had never seen the influenza virus before. They had been staying at home. They weren't congregating at all. And you had multiple cohorts of kids seeing the flu virus for the first time at the same time. That was likely, keyword likely, driving that rapid uptick. But I don't think we're seeing that this year. This year's largely being driven because, number one, it's an H3N2 season, which tends to be more severe at a population level. And then number two, the vaccine isn't as protective as we would like. It still provides some protection, just not as protective as we would like. Those are probably the two biggest drivers here.
Okay, appreciate that. And we really appreciate the viewers chiming in this week. Cheryl, our viewer, has this next question for you, Dr. Bogoch. She's asking, is it better to keep the temperature in a gym to a cooler setting to offset the flu germs in the air? She says people come out to sweat out their colds, but others don't want to get sick.
Yeah, it's an interesting question, but no, I mean, listen, the influenza virus kind of prefers a cooler, less humid environment. But the key point here is if you want to prevent the flu from spreading in an indoor setting, you know, there's excellent resources on the Public Health Agency of Canada's website where you can see how to improve the ventilation in indoor settings. And it has a multitude of positive benefits, one of which is to reduce the spread of respiratory viruses that are transmitted through the air. That's probably the best way. And of course, some viruses are transmitted through the air, others are transmitted through high contact surfaces and other people contacting those surfaces. So, you know, good hand hygiene and of course, wiping down high use equipment would also be a very good mechanism to reduce the spread of infections in that environment.
And what about saunas and steam rooms? A lot of people like to sort of either start or finish their workouts in areas and elements like that.
Oh my God, those are the best. Yeah, who wouldn't? They're fantastic.
Yeah, no kidding. Yeah.
I mean, anytime you have people congregated in an enclosed indoor space, you know, that is a prime area for respiratory viruses to be transmitted. Yes, of course, temperature and humidity play a factor in either increasing or reducing the risk of transmission. But if you're really close to someone and they're, you know, sadly infected with a respiratory virus and you're sitting right next to them and they're coughing out a lung, yeah, there's a much higher probability you're going to get it, especially if you're in the same indoor environment. Stay home if you're sick. Don't go to the gym or work or send your kids to school to get other people sick. Not fair.
Okay. Dr. Bogoch, our next question comes from Mary. Mary says, for the past 3 days, I have had severe allergy symptoms, but did not feel unwell. This morning, I woke up with muscle aches, low-grade fever, and feeling lethargic. I am otherwise healthy senior. Is this H3N2 virus?
Oh, I hope Mary's feeling okay. You know what? There's really no way of knowing. There's a lot of respiratory viruses circulating. Obviously, we talk about flu, COVID, and RSV, but the list of respiratory viruses circulating is longer than your arm. And this could be any one of them because the syndrome of all of these has significant overlap. The key message here is, you know, obviously, if you're feeling unwell, most people can recover in the comfort of their own home. Having said that, if people are feeling exceptionally unwell or they can't care for themselves or they're getting dehydrated, you know, or you're worried, then it's time to go see a physician about that.
Yeah, okay, you're going to try to sneak this one in quickly, Dr. Bogoch. Our viewer Asit is asking this. I have a cough and chest congestion, but no fever. Can it change into bronchitis?
Well, that's the syndrome of bronchitis is cough, feeling unwell, sometimes sputum production. Like that sounds like a bronchitis. When we think about respiratory viruses, we think about upper respiratory viruses, like the upper airways, including bronchitis, and then the lower respiratory viruses, lower respiratory infections, which are basically involving the lungs, where people will feel really, really unwell if there's a pneumonia. The key here is prevention. And, we have vaccines. We can put on a mask if we want to reduce our risk of infection. We can improve the quality of air in indoor settings. But what that person's describing, it sounds like they feel unwell. That could be a lot of different syndromes, but the key here is preventing them in the first place.
Yeah, we know you can't diagnose someone across the TV, so appreciate the efforts here, though, Dr. Bogoch. And thanks for answering our viewer questions. Thanks to the viewers for sending them. And Dr. Bogoch, again, thanks for making yourself available and for doing this morning. Appreciate this so much.
Thank you. We'll chat again next week.
Have a good one.